episode 109, Myofunctional Therapy and Ill Effects of Mouth Breathing and Sleep Apnea. I'm your host, Dr. Justin Trosclair, and today we're Sarah Hornsby's perspective. Join 2017 and 2018 Podcast Awards nominated host as we get a behind-the-curtain look at all types of doctors and guest specialties. Let's hear a doctor's perspective. Thanks for tuning in again. February, make it your best month ever, or at least your best February ever. You know, that's something I've always was told, you can't compare too often January to February, December, January, February. You should look at February 2019 versus 2018 versus 2017. That way you can kind of start seeing a trend like, oh, Februaries are sometimes down. What can I do about that? Or, wow, they're really good. What was I doing in the past? Let me duplicate that. Make sense? Okay, I'm back from America. Whew, so good. Seeing friends, seeing my parents, hanging out with the baby, eating so much food. Oh, it was a sad day to have to go back, fly again with the 4-month-old. Yeah, but the parents coming with me to China, so I get to experience what I've been experiencing for the last couple of years. I think that'll be a good time for them, or at least a cultural change. And I think that they can appreciate, at least those things. Well, today on the show, we're talking myofunctional therapy. It's a continuation, if you will, from episode 105, where we had the dentist, Dr. Alan Sprinkle, on, talking about tongue-tie surgeries and mercury-free dentistry and things. And he mentioned this term, myofunctional therapy. And I was like, what is that? Well, did a search, and Sarah came up on MyFaceology, which is her site. And my goodness, there was so much information. I was like, okay, I got to get her on, chat with her, find out what this whole thing is about. What does it help? What causes it? And, what is the actual therapy? So we're going to go through all of those things. What are the goals? And all of this is about, a little spoiler, is mouth breathing. When you're a baby, when you're younger, if you mouth breathe instead of breathing through your nose, your palate forms differently. Your tongue is supposed to rest in your mouth a certain way. And so it ends up changing your airways. So like later on in life, you might get sleep apnea. You may need braces, those types of things. Then, we answer questions like, why do babies suck a thumb? What are the differences between anterior and posterior tongue ties? What can they do about it, if anything? And what's cool is she does telemedicine. That's what she does all the time now. She's got people underneath her, which I didn't realize till the end. We talk about some devices that you can use besides braces, for instance, if there's if you need to go that route. And the unexpected challenges of being a boss and managing several people. Not something you would think of when you're just starting out. And then she also does a little bit of mentoring. So people who are into this, they might be kind of new from being like a dental hygienist. They're like, how do I approach doctors? How do I approach patients? What do I say? I've had this complication, this complicated case. What do I do with this? So she's kind of like a mentor because she's been doing it for so long. All right. All the show notes can be found at a doctor's perspective /109. Again, check out the resources page on the site for all the potential things you might need as an affiliate, and as well /support if you look at wanting to host a cup of coffee or support the show financially in any way. There's some bonuses for those who do monthly, and we do appreciate those who are doing that. It makes you feel a little bit more impactful. Like, oh, what I'm doing matters. What I'm doing is reaching people. It's affecting their practices. It's affecting their lives. It's improving their relationships with their spouses and friends and things. So it's real cool. Let's go. #behind the curtain. Live from China, it's Seattle, Washington. Today on the show, we have something you've probably not heard of before, but it pairs in with the dentist that we had just a couple of weeks ago. But it's called myofunctional therapy. And her name is Sarah Hornsby, and her practice is called Faceology. Please, welcome to the show.
Thank you.
Well, pre-chat is fun. We always have a few things to kind of figure out. Technology today, it's great when it works, and then when it doesn't, you're like, all right, backup plan number 2. So that is one of these episodes.
Exactly.
So excited to have you on. Just to begin with, give us a little background about yourself. And if you want to, you can bridge it into a little bit of like how you got into like myofunctional therapy. What is it? Those types of things. Yeah,
it's a good question because whenever I'm talking to people, they're like, how did you get into this? It's such a weird field. And I'll explain more about what it is. But I'm a dental hygienist by training. So I went to school to learn how to clean teeth. I did it for about a year. And at that point realized, I don't know if I can do this for the rest of my life. So pretty early on in my career as a hygienist, I was looking for other options and looking at like, well, how do I go to dental school? Or maybe I should go get an MBA. Or I just didn't know what I wanted to do, but I knew I couldn't keep scaling teeth for the next, 30 years or whatever. And it's not that I didn't like the patients, because that's what I loved. I love the connections. I think anyone who goes into healthcare loves connecting with people and helping people. So it wasn't that. It was just the basically slaving away, 9 patients in a row all
Wow.
day. And I thought, maybe I can do more. So to make a long story short, I found myofunctional therapy by accident. I was reading a dental hygiene magazine, and there was a little tiny ad in the back, and they talked about, change your dental hygiene career in like a 4-day course. And I thought, okay, well, I mean, if this is true, I better do it. So I paid the money, and I felt like this has to be a scam. I mean, this can't be real. I've never heard of this field. My dentist I work for has never heard of this field. It can't be real. But I was sitting in the class realizing that I had a lot of the symptoms that I was learning about, and that's really what kind of kept me going and kept me interested. Otherwise, I mean, if I didn't connect with it personally, I probably would have been like, okay, that was a waste of money. So
I tried something new.
yeah.
Well, I like advertising. It's so funny that nobody would have saw that ad unless they were exactly the person that I'm looking to change and not just do dental hygienist. So that's kind of fun to see that it worked, and you're still just like, what is this?
I didn't know. And that's, I think, the biggest problem, which, we can talk about any of these topics more. The biggest problem with my field is that most other healthcare providers don't know about it. And that means that most patients don't know about it. So there's a lot of people who need the therapy that I do, but they don't even know the question to ask that would get them to me. And even if they did ask the questions, like 99% of the time, the doctor or dentist they're asking isn't going to know to refer to someone like me. So it's a problem for sure.
Well, I never heard about it until, like I said, mentioned there was a dentist on, and he was an alternative dentist who doesn't do mercury free, he's mercury free. And so already he's kind of like, whoa, hey, who's this guy? And,
yeah.
And like, I didn't really have an opinion about it one way or the other. I just had heard about it like, oh, there's alternative dentist, So I was like, well, what's that about?
Yeah.
And then I found out he does a whole bunch of like tongue tie surgery himself.
Yeah.
And he had to get a bunch of training with that. And then from there, he's like, definitely check out, but he has a whole website about it. Xanther.
Xanther. I was going to say, is it Dr. Sarush Zaghi? Because he's kind of like the famous tongue tie doctor. So to people in my field, he's like a celebrity doctor. So
that's the guy. That is the guy. And then on his site, looking for like other people. And then you have like just the therapy people. And I was like, oh. And then you had actually a really good website.
Yeah, I've worked hard on that website. I try to have information out there for patients who have never heard of this. So my website's unique, and I think one of my best marketing strategies has been reaching out to the patients directly. If the dentists and doctors don't know about this, then how do I connect with like the parents or the patients who have the symptoms and are Googling and searching YouTube? So that's really why I started making videos,
Yeah, if y'all are on your phone right now, check it out, because it's almost everything you would need. I don't know if they have an official myofunctionaltherapy.com or something like that, but that's what I thought I was on to begin with, because there were so many good answers and good questions, and like the professionalism of the website. Like I try to design my own, and yeah, you can tell. And
no, good. I found it.
It's so good. So anyway, so it's really cool. If you don't have any clue about it, you can follow up on her site. You got videos, and you have lots of different, but after this podcast, people should know after hearing what you have to say. So, boy, where to begin?
Yeah, I can explain like what I actually do, because that'll help people, I think, as they listen, Basically, I tell people that I have 4 basic goals for every single patient that I see. So number 1, you have to breathe through your nose all day and all night. You've got to use your nose for breathing. Number 2, I want you to have a good lip seal. So when you're not talking and you're not eating, you've got to have your lips resting together. Goal number 3, your tongue has to be up, filling the whole top of your mouth, like the tip, the middle, and the back of your tongue. It has to fill up your oral cavity 3-dimensionally. Goal number 4 is you have to swallow correctly. And these things are basic, simple things that honestly, we shouldn't need a therapist for. We should be born doing these things innately and naturally, and we should never even think about it. However, there are things that can make these 4 goals that I have not come to you naturally and innately. And that was me. I was a kid breathing through my mouth. And when you think if you start to look at what causes mouth breathing, like everything. So allergies, asthma, large tonsils and adenoids, thumb sucking, tongue ties, all of these things that we're looking at as problems that need to be solved, they're actually leading to these other muscle dysfunctions, breathing dysfunctions, swallowing dysfunctions, and that's really what I correct. So, I mean, that's the simple version, but if you can address these things in growing kids, they will have good jaw development, they'll have good airway development, and they'll end up being adults with better dental structures, facial structures, and they're less likely to have sleep apnea, jaw pain, and a lot of the bigger picture symptoms that I treat in the adults I see.
So you made me think, it's like, okay, that was really easy. So we keep our lips closed, we're breathing through our nose, our tongue should be in the, pretty much on the roof of our
Top
mouth
of the
in
mouth.
a sense. And then you got to swallow it. And I'm thinking, okay, not sure how much of my tongue is in the middle of my tongue on my roof. I'm trying to like do it while we're on the phone.
It's not for a lot of people. I mean, if you were a kid who struggled breathing in any way, you're probably an adult with these symptoms. And it's not like it's a big deal until it starts to affect you. So kids who are mouth breathers, it accumulates over decades. So if you're a kid breathing through your mouth, if you're a kid who's tongue-tied, you're very likely at some point in your life to be an adult with sleep apnea or TMJ issues, which connects to so many other fields like chiropractors.
Yeah.
If you're trying to work on someone's TMJ and adjust their atlas or, whatever you specialize in, if you're trying to fix that, but they're mouth breathing and their tongue is low, you're still never able to get to that root issue. What's going on with their body alignment if their mouth is open? That's not how we're meant to be.
You said like with the allergies. So pretty much anytime you just feel really stuffy, like those types of people who are like, I can't ever breathe through my nose because I've already have allergies. Something's always swollen in there.
Yeah.
And so I have to, breathe. So it's just through your mouth. Is there anything as a doctor we can look at?
It's only at night.
Oh, it's at night too, maybe.
Yeah. Go through a patient's health history and find out, did they have allergies or breathing issues when they were younger? If so, they might have leftover habits that could be contributing to these bigger problems that they have now. If they currently have allergies and currently have, trouble breathing through their nose or a severely deviated septum or large tonsils and adenoids, those are all reasons that somebody would still breathe through their mouth even as an adult. And it might only be at night, but if you sleep for 7 or 8 hours a night and you're mouth breathing that whole time, it's still not good. So,
Would they know? If you're a mouth breather, you're a mouth breather?
Not always. And that's the crazy thing is most people are either in denial, like I was. I never knew that I was until I was sitting in that class and I started really kind of being aware of that and checking in with that. And once I found out, I was horrified. I was so embarrassed. I was like, how did no one tell me this? I was like 22 or 23 at the time. And I thought, why did my parents not know about this? Why did no one I was like going back to every like doctor and orthodontist and like even through my professional training as a hygienist, I thought, why did no one talk about this? And I was upset for a while. And that's really why I kind of was like, I'm going to go out there. I'm going to talk about this stuff because, I'm an adult with a higher risk for sleep apnea based on my structures. And I'm not overweight. I'm healthy, but the way my jaws grew and the way my palate is structured, I have a small airway and that, could have been changed. If my face grew more forward and if my palate grew wider, I would have more space for my tongue and I would have a more open and fully developed airway. So
you have, what do they call these? I don't remember face shapes. Kind of like a teardrop face?
Yeah, I mean, I have a narrow palate. I have kind of a narrower face, a longer face. There are facial features that you can look at in when you look around people, like, I mean, I can't unsee it. It's like once you know what you're looking for, you're like, it's everywhere. So yeah, I see all sorts of people on TV and at the grocery store, at the bank, out in the world living life. And I'm like, they need myofunctional therapy. Everyone needs it, so.
Will you see like the jaw sort of be, instead of kind of thinner, it'll be kind of around the same shape as your zygomatic arch kind of area?
Yeah. So the facial features tend to be flatter, like the cheekbone area will be flatter. Maybe the mandible is smaller. Anyone who has an underbite, that's a little different, but really the maxilla is small. When somebody has an underbite, we call it a class 3 malocclusion. It's not so much that the lower jaw is too big, it's that the upper jaw didn't fully develop forward. So there's a lot of things that I can see. If you look at faces all day, probably like you look at certain things you can recognize in people's postures or how they hold themselves. Like you can probably identify stuff from across the room that I wouldn't know what I'm looking at. But with this stuff, I see it a lot. So
let's see. So we've got the basics.
Yeah.
We've got both kids, we got adults. When we're talking about kids, I know sometimes if a baby's not nursing very well, some doctors can obviously tell, oh, there's a little tongue tie. They just kind of do a little surgery, boom, they release it. But what I've seen, after that interview with the dentist, it seems like they go deeper. They figure out, no, that wasn't enough, or they just missed it completely. And you can't actually, like I said, stick your tongue out. You can barely open your mouth, not even 50%, like when your tongue is on the back of your teeth. So
Exactly.
as far as a kid goes, their doctor said it's fine. Maybe they released it a little bit. How do you train a 6-month-old or a 2-year-old to not mouth breathe?
Yeah, that's the hard part. So with kids and babies and toddlers, the younger they are, it is more challenging. So the ideal time to release a tongue tie is when babies are really little and they're still breastfeeding, because breastfeeding is like myofunctional therapy for babies.
Okay.
So if a baby is breastfeeding and they're a couple days old and they get a good latch and now they can nurse, they're not going to need exercises when they're older.
Okay.
The tricky part,
unless they suck their thumb or something.
yeah, and hopefully they don't. I mean, hopefully if they're nursing and they've got good oral development and good muscle development, and hopefully they won't suck their thumb. I think there's a lot of theories that the reason kids suck their thumb is because they can't get a full palatal contact with their tongue. And, if you look at Chinese medicine, if you look at like even the anatomy of how like there's a lot of nerves at our incisive papilla area, like right on the roof of your mouth, that's right where your tongue should touch. And if you're tongue-tied and you physically can't make that contact with your tongue, then the theory is, according to some people, that you're trying to get that stimulation by your thumb in other ways. So your thumb,
because they always put stuff in their mouth.
Yeah, or you
so
put stuff in your mouth, fingers. Yeah, there's some like neurological feedback, or there's some endorphin release. There's something that kids get out of that thumb sucking that they're not getting from their tongue. At least that's one theory. And, as far as like research behind that, I don't know, but I hear a lot of people talking about this in my field. So
does the pacifier do the same thing as a thumb? Because I've heard stories that if you suck it for years, I don't know how long you're supposed to use it for, but it could do the same thing.
I think it can. Yeah, I think that can. That's maybe why, babies stop crying when you give them their pacifier. It's so controversial. Some people are like, never use a pacifier. Others are like, it's okay under 6 months. And other people say, as long as you quit before 3. So
there you go. See?
There's a lot of, and I'm not a mom, so I'm always like, I don't want to like judge or make people feel like you've got to do it a certain way. I mean, I know moms struggle. I work with moms all the time and they feel guilty when they can't breastfeed. My sister had a baby and she couldn't breastfeed. She ended up having to bottle feed and go back to work after a month. So, everyone tries their best, but I'm always just like, I'm not judging. I just tell you, like, if you breastfeed, it's not just about the nutrition from breast milk versus formula. It's about muscle development, suck, swallow, breathe coordination. There's so much that happens, even palate width. I mean, we do have research saying that babies who breastfeed have wider palates than babies who bottle feed. They get narrow palates or they get vaulted bubble palates. And then it's harder to keep the tongue up. So much of what happens when we're babies and our oral development influences us later in life, for sure.
And see, I just got a 3-month-old, and it's just, she's such a cool baby. Like, she don't even want the little pacifier. Like, I grew up, you're supposed to give it to the baby, and she's like, bah. And I'm like, all right, well, I guess just eat your fingers for a few minutes.
Yeah, people always say, well, what did ancient people do? What did our ancestors do? And like breastfeeding would have been a baby's pacifier, in an ideal world, the mom and baby would be together all the time. And when they need that comfort, when they need to suck or nurse, then they breastfeeding is the answer. So, I mean, we don't all have that opportunity in like modern society with jobs and, crazy lives and stuff. But if you go back in time, that's what I try to do. Like, what did people do before we had like...
A lot of babies probably died in the street is probably what a lot of babies did.
Probably, yeah.
Oh, we don't have a cow for milk. I don't know what we're going to do. Susie said she's not breastfeeding other people's babies anymore. I guess it's real.
Oh, gosh. Yeah, but the tongue tie thing, I think there are more tongue ties than there used to be. So I think this is a complicated thing that's happening, but epigenetic changes with like modern food, modern, the toxins and pollutants and stuff in the air, we're getting some of these epigenetic changes that I don't think if you go back even 300 or 400 years ago, there wasn't so many people that are tongue-tied. Part of it is, yes, we're looking more, we see it more, but There's more to it than that. I mean, we are seeing changes in jaws and skulls. And if you look at like Weston Price and some of the stuff that he could see, epigenetic changes happening within
Oh,
just
wow.
1 or 2 generations when, these traditional tribes and cultures would go from eating their normal diets, whatever they would eat naturally, and then they go to the modern food. And within 1 or 2 generations, the kids have cavities, they've got worse jaw development, their mouth breathing, they've got all of these issues in a very short amount of time.
My wife is Chinese, and when she came to America those first few years, she's like, "What is going on with y'all?" I was like, "What are you talking about?" She's like, "Y'all got like gluten intolerance, peanut allergies, all these different things." I was like, "Y'all don't have
I
that
think
here."
that's all
And living here, I'm
connected.
like, I've never heard anybody, "Oh no, a peanut." I mean, I can't eat rice. I've never heard anyone
Totally.
complain about that. Now maybe they have IBS and we just don't talk about it.
No, I think there's more to it. I mean, industrialized societies actually have a lot more of these type of like allergy issues, sleep apnea. I mean, sleep apnea is a very modern industrialized
Yeah.
nation problem, and it has to do with, of course, there's the weight side of things, but it also has to do with our airway and our breathing. And if we have high rates of allergies and high rates of mouth breathing and high rates of tongue ties, now we're having more rates of these bigger issues too. So
Yeah, it is.
it's complicated though.
When we're talking tongue tie surgery, that's called a frenuloplasty. There's anterior, there's
Yep.
posterior. Anterior kind of makes sense to me. The kid can't, stick their tongue out very far. I mean, it makes sense. There's like, but what's a posterior version of that, and what can we look for?
Yeah, the posterior tongue tie, it's, to me, I'm like, a tongue tie is a tongue tie. It just depends on how bad it is. So if it's anterior, it's usually pretty bad. But if there's an anterior, then the posterior end is restricted as well. And what we have to look for is, at least what I look for is, can the tongue reach the palate? And if it can't, then to me, that's
And not
a
just the
problem.
tip of the
So
tongue.
when I'm looking at, yeah, not just the tip of the tongue, the middle and the back. So I have this mouth. I know that, you can see me, but I've got this mouth and I'm showing you the palate here, but the tip of the tongue should be here, the middle here, and the back there. So really, the whole tongue needs to touch, like it's almost like laying like a blanket across the whole top of the mouth. Now, if you're tongue-tied, you can't do that. So to me, I'm not really into like having surgeries just for the sake of
Okay.
having a surgery. I want, a tongue tie release to be like a means to an end. So I prepare the muscles. I help people with exercises beforehand. We strengthen the tongue. We give you coordination. We work on a bunch of stuff. Then you have the surgery. And then after the surgery, now our job is to get your tongue to go where it should. That's how we're meant to be. Our tongues are supposed to be in the top of our mouth. That's how our jaw development and palate
So
development.
you can help the surgeon in a sense. This is where we're seeing he's having these issues or this lady's having these issues. And they're like, oh, okay, that means I should probably do more of this type of surgery potentially, or
Yeah, so I'm just trying to get to the function. If the tongue isn't functioning correctly, if it can't rest in the right place, and that means you can't speak in the right way, you can't swallow in the right way. So to me, releasing the tongue tie is just part of a many-step process where we're trying to get proper oral muscle function. So that's really what I'm doing. But the posterior part comes when you can't get the back of your tongue to go up. Some people with a posterior tongue tie, their tongues look pretty mobile. They can stick them out, they can point them up, but then as soon as they try to rest on the top of the mouth, it feels exhausting and it feels hard to keep it up there and they struggle. So a lot of people who are adults and have a posterior tongue tie that hasn't been detected because it's not very obvious, they end up with clenching and grinding, facial pain, jaw pain, TMJ issues, chronic headaches, chronic neck and shoulder issues, and that's from dysfunctional muscle use. When the tongue can't function properly, now the muscles under the floor of the mouth, the muscles in the neck, all of these muscles, even like the temporalis and the muscles of mastication, they are now overcompensating and working in dysfunctional ways because the tongue isn't doing its job, if that makes sense. That's kind of a simple way of explaining it, but there's compensations going on that I'm trying to disconnect, disassociate those muscle compensations for people who are tongue-tied as
there's a
adults.
whole lot of kinetic
Basically,
chain.
they've built up. Yeah. Oh my gosh. Basically, these people have built up over, if they're 40 years old and they've been having all these muscle compensations and muscle problems because they're tongue-tied, they're probably going to have clenching, grinding, jaw pain, facial pain, headaches, all that stuff. So
I get a feeling your clientele is probably a lot more like adults because
these days,
when
yeah.
we're okay, so let's say we got kids, they're 4 to 8 years old, and they're getting to that point, all their teeth are there. You're noticing they got some gapping, some cross bite. think, I gotta pay for my kids' braces. No. Is there, at
Yeah.
that point, you're like, all right, your teeth are just messed up. At that point, should you also look into the myofunctional stuff? Because at that point, maybe they could spend the next 6 months doing certain exercises or something and see what happens.
Definitely. Yeah. Yeah, for sure. So when I work with kids, I would say about 60% of my patients are adults and 40% are kids. So I still see a lot of kids. And when I'm working with kids, it's all prevention minded. We're trying to basically guide their growth through proper oral habits and breathing. If you can optimize the growth of the jaws and the growth of the palate, then the teeth should come in straight. You shouldn't need braces if everything grows the right way. Now, the first sign that parents should look for is your kid mouth breathing, even if it's only at night. We grow a lot at night. And if you're growing in that open mouth posture, even if it's only at night, it's not good. So that's going to be, you're going to end up with crowding. You're going to end up with a narrow palate. You're going to end up with that vertical facial growth. And that leads to a lot of the problems that I have as an adult and that my adult patients have. So look for those symptoms like mouth breathing in kids. That's the most obvious common thing that if you tune into.
Mouth breathing is literally just your mouth is open?
Your mouth is open.
Like when they sleep, they're just like,
and you can feel it. Exactly. So if your lips are apart, even 1 millimeter, your tongue drops. And it's that tongue dropping to the bottom of the mouth that, now the palate has no support. There's no structure for the maxillary arch, as we call it in dentistry. So, that means that you're not going to get forward facial development if the tongue is down low. Now, the maxilla is just hanging out. It's not getting any stimulation. It's not getting any forward facial development or natural expansion from the tongue. So, look for that. And then the best thing you can do is find an orthodontist who's airway focused. So if your kids are mouth breathing and you're looking, you've got to get those habits under control. So whether you do it on your own or work with a myofunctional therapist, orthodontists who are looking at tongue posture, who are looking at the airway, who are looking at mouth breathing, those are the ones I'd recommend. Not all of them are, unfortunately. This is like my biggest challenge is finding the orthodontists who get what I do. If they're not looking at what I'm doing, then I think, in my opinion, they are missing a huge piece of the puzzle. They're not, if you're not looking at the tongue and the mouth resting posture and the mouth breathing, then you can put braces on kids, but it's not going to stay stable and you're not going to guide that growth in the right direction.
Oh, that's what you mean. Like, so that your teeth will get straight, but if you stop wearing your retainer like I did, you'll start getting some of your crossbite and all those things will start coming back.
It'll come back.
Because I'm pretty sure I'm a mouth breather at night because I'm thinking, I'm looking at my kid. I want to go home and look at my kid and be like, is your mouth closed when you're sleeping? Because I'm pretty sure mine don't because, my mouth will dry out or whatever.
Yeah.
So I know that's going on.
Yeah, exactly. If your mouth is dry, if you wake up with drool on your pillow, those are signs. But yeah, not to put you on the spot, but yeah, I think you could benefit from myofunctional therapy.
I noticed I was watching one of your little videos, which are actually good. I don't think you took one take to make that. Let's just be honest. It looked like you were you practiced
Which
a while.
One?
No, just the basic. What is myofunctional therapy? It was so good.
Oh gosh, well,
that was my point.
I talk about this stuff all day, so
it was a polished.
I don't have to practice it.
Yeah,
but...
it looked polished. Let's just put it that. It wasn't like me jumping on the camera.
Oh,
and just,
thanks.
Hey, what's chiropractic? Well, let me tell you.
Yeah. No, those videos that I made, they really came out of, I do these free assessments with people. So I offer a 30-minute free assessment so people can ask questions. And, it's kind of weird. If you've never heard of this field and you've never met me and we are doing it online, then I feel like I want to give people an opportunity to ask me questions and to understand, why would you pay someone to help you with these habits that seem so silly? So I talk about the same things over and over and over with pretty much every person. And so I thought a few years ago, I was like, I should just start putting together, little video clips of the things that I say all the time. And then when I finish my calls, I can send people the video links. And so when I started these videos, it wasn't for marketing purposes. I never really thought that many people would watch them. And here we are a few years later, and my YouTube channel surprisingly gets a lot of views.
Yeah, if you've learned anything for SEO and keywords and how to do that stuff, if you haven't, you should go do that. So that way you can really optimize your videos. But people are finding it. They just type it in and then
People
Yeah.
find it. Well, I think, there's not a lot of people making videos on like tongue ties and mouth breathing
And
and,
kudos for
stuff like
you
that. So,
for doing Skype type assessments, telemedicine, if you will, because
exactly, telemedicine.
you can go across the world instead of just Seattle.
Exactly. Yeah. And that's really how it started. I mean, I had a practice in Seattle where I would see people in person for about 4 years. And then it just got to the point that it was like 4 years ago today, actually, like December 2014 was when I thought, okay, I think I'm going to actually close down my physical location and I'm going to try to take this whole thing online. Because even my local patients, nobody wants to drive in traffic and nobody, if you can do it at home from the comfort of your house, like why wouldn't you want to
No
do
kidding.
that? So, I mean, for me, as long as people have a good internet connection and good lighting, I think the therapy is even better online than, if you come and meet me in person. So,
Yeah. Plus, nice is profitable now too.
yeah.
That's stuff that we talk about on
um,
the show. It's like, hey, now my overhead is literally this 200
yeah.
square foot office in my house. I mean, that's it.
Exactly. And yeah, I think a lot has changed in the internet world because if you think back to 2014, it wasn't that long ago, but internet speeds were way worse. I mean, it was harder. Now, I mean, I've got like a 300 meg connection in my house and most patients have pretty high speed internet, but back then I would meet people who still had like dial up
Oh
and I
man.
would be like, "Oh, this isn't going to work." And so I really had to get into like the technical side of like walking people through like can you run a speed test? And what, and they're like, well, I have 4 bars. I'm like, no, it doesn't work that way. So I really had to get pretty tech savvy and like understand a lot of the stuff that I never would have if I just kept, seeing patients in person.
Oh,
So
that's great. I'm going to come back to this,
yeah,
but I wanted to round out the more, what is all this part of the interview?
that's okay.
I'm thinking, okay, I heard about this thing called myomunchy, and
Hmm.
I think she's going to come on the show. But you also mentioned something
Cool.
called advanced lightwear functional device and a daytime, nighttime device. They
Appliance.
look like
Hmm.
wire things that you. What are those? And
Yeah,
can
they're
anyone
kind
use
of
those?
they're alternative, I guess. I mean, that's kind of a dumb word, but they're, I think, more airway centric or airway oriented orthodontic appliances. So they're
Oh,
looking at the things I look at, but it's an orthodontic treatment. So for me, if I meet somebody who does an Alpha appliance, who's a doctor, actually, I think the Alpha appliance was invented by a chiropractor, or at least partially. Dr. Derek Nordstrom in Los Angeles. I think he might be a dentist, but paired with a chiropractor, I don't remember. But that advanced light wire appliance is meant to apply gentle pressure, and it works with your tongue. So each time you swallow, it stimulates the palate to remodel, and so it's really a lot along the lines of what I'm looking at because it's straightening teeth, it's moving teeth, but it's looking at the tongue and the breathing and the airway. So it's not just like, oh, we'll give you a great smile. It's like, let's make you healthier. Let's get your palate wider. Let's optimize your growth and development if you're a kid. And that's really important to me when I'm looking for orthodontists. So if I find somebody who's doing that Alpha appliance, I know that they're probably going to know about what I do. And probably 1 out of 100 dentists has actually heard of what I do, maybe less. So it's growing, it's changing, but for me, it's really about finding those like-minded healthcare providers because I can't do it on my own. I have to find a team of people who get what I do, and that can be the ENT, that can be the dentist, that can be the orthodontist, it can be the chiropractor, it can be, oh
right.
my gosh, I mean, I can't, I can only teach exercises, I can't do everything. So
And when we're talking results for an adult versus like a kid, I know an adult has an issue versus a kid who you want to be proactive, especially like in my family, we've all had braces more than likely. It's like, well, there's a good chance that there's something that we can do ahead of time. How long does it take to see results, kid versus adult?
I mean, when I work with people, I usually put them through a 12 session program, and that program spans anywhere from 6 months to a year. So that's not because it's like, I just want to see you that long. That's because it can take a while to change those habits. So, I mean, for me personally, I think it took me about 18 months before I really felt comfortable keeping my tongue in my palate, breathing through my nose, and I never had to think about it.
Wow.
So, I don't want people to have to be like forcing themselves to do these things. I want it to become subconscious and just part of, how they are. I don't want it to be forced. So to get to that point, it takes a little longer, but I would say in general, after 4 to 6 weeks, people start making big changes. So
Okay. Because you got all of a sudden you're having to be conscious of your breathing, which is so difficult because we've got so many other things to do.
I know, and it can even, yeah, and it can span into like mindfulness, and it can span into, like a lot of people who are into that kind of thing, they talk about feeling your tongue in your palate and feeling your, breathing through your nose and just becoming super aware and mindful of these things that aren't natural to think about. It takes practice. So
have you ever looked into, they used to, people, if they smoke, they might pop a rubber band, or I don't want to be a negative person, and they wear a rubber band and they snapped it every time. Do you have anything like that? Like, remember those Live Strong bracelets that were so cool? Some people still wear those.
Yes,
do you ever have anything like that says, hey, watch your tongue?
Yeah, I have a lot of different reminders. I even have people, there's habit reminder, like there's apps and stuff that you can download. I have people put these little colored stickers. I don't think I have any around me right now, but you can put up like little color stickers that are supposed to be like visual, reminders to check in with yourself. There's a lot of, habit awareness, things like that people can do. So I try to incorporate a lot of that stuff to make it easier for people. But yeah, no, that's a good one. Mm-hmm. You forget, well, it's not a normal thing to think about, it takes practice.
If you put a sticker on your cell phone, you know how many times a day you'd probably end up practicing because you pull your phone out, you're like, the red sticker.
Exactly. Yeah, or like the computer monitor screen, that would help me because I'm at my computer all the time. Yeah. So, I was just thinking, I didn't talk about the DNA appliance, that daytime, nighttime. You asked me about that, and that's just another version of the orthodontic appliance that it's similar to the Alpha appliance. It actually, the DNA appliance has been sold to a company. I'm pretty sure that's what happened, but it's called Vivos.
Okay.
Vivos. And if anyone wants to look that up, the Vivos appliance is actually FDA approved to treat sleep apnea. So. Yeah, so it's kind of a cool one.
And that's, again, so orthodontics would put that into your...
It's an orthodontic, yeah. A dentist or an orthodontist, it's an appliance that I think sometimes they're removable and you wear them at night. Sometimes you wear them during the day, too. If you're trying to treat sleep apnea, not everyone just wants to wear a CPAP for the rest of their life. So the theory with these appliances is if you can give somebody a wider palate, give them more airway space, and give them more jaw development orthodontically, then it's an option that's not surgery, and it's not a CPAP, and it's not just a mandibular advancement device that is a common dental appliance to just basically move your mandible forward to keep your airway open at night. Wow. So I think, if I had sleep apnea, that's probably what I would do.
So you could do the Vivos along with the training that you would do, and you probably see results.
Yeah, and myofunctional therapy. Well, that's critical. Like if you're not actually addressing the breathing and the tongue posture, you can do any surgery, any appliance, but you're never getting to that like root cause.
Wow.
So yeah, you've got to include that.
Man, there's just, if I say this, if it works as well as we hope it would, it seems like it should spread like wildfire. Like, you got sleep apnea?
That's what I think.
Should do these exercises. Here's a pamphlet. Oh, you need more help? Here's a website you can visit, and there's all these practitioners in the nation that can help you out, it would seem.
Well, it's not to sound like jaded and cynical, jaded and cynical, but there's not really a way that like an industry can make a lot of money off of therapy like I do. So it's not something that insurance companies have been able to capitalize on yet. Mm-hmm. It's not something, like a CPAP machine. The sleep, it's easier to make money on that kind of thing, and I think that's why you
need a device.
Yeah, you need a device, or like here's something you can hand someone, and unfortunately, therapy doesn't really fit into that so well. Yeah. It's changing though. We're just getting research within the past like 3 to 5 years connecting tongue ties and sleep apnea, mouth breathing and sleep apnea. So especially in kids, and there's a lot of research that will be coming out very soon. That's like, nobody's going to be able to ignore the connection of mouth breathing, tongue ties, and sleep apnea in kids. So.
Oh, fantastic. That'll be fun.
Yeah.
I look forward to seeing some of that stuff.
I hope. Yeah, I know. I'm excited. There's a dentist he's an orthodontist in Australia who's doing a lot of research. He's compiled like 15 years of research on like 4,600 patients or something crazy, and they're all kids between the age of 7 and 9. And he's pretty much making this stuff like super out there, and he's including myofunctional therapy as part of the treatment plan to help kids with sleep apnea. So that's good. It's good for my field. So my field will spread like wildfire, like you said. I really think in the next 5 to 10, hopefully not 15 to 20 years, but hopefully very soon, it will become as mainstream as like, I need braces, I need myofunctional therapy. So that's my hope.
Yeah. I mean, I get that because you want to be able to be paired with like-minded orthodontics and dentists who see that the purpose of it is, and then there's like, okay, this is what you need to do along with X, Y, and Z.
Yeah, and I don't want people to think, oh, just do this therapy and you'll cure your sleep apnea. I don't want people to think like I'm gonna cure them, because I'm you can't cure sleep apnea. You can't even know if you have it without being diagnosed and having a sleep study and all those things. So for me, it's just about getting people to whatever treatment they're pursuing to look at this as part of it, as a critical part of it. I hope that becomes part of the conversation as the years go by.
What are you doing for marketing?
Not a lot.
Really? Okay.
It's all word of mouth. I haven't really marketed, and that's been something that I've got a big project for 2019. So I've been able to survive, and my website gets a lot of views. My YouTube channel brings people to me.
That's marketing.
And it's kind of, not paid marketing, I guess. I write a lot of articles for my website, and really, that's it. So I'm looking into like what can I do in 2019 to actually like maybe pay someone, do ads or something. I don't know what that looks like yet, but yeah.
From what I've learned, you're doing a lot of what they call content marketing. So you've got your basis of lots of different articles. You got lots of YouTube videos that are already doing organic. You got a lot of organic reach.
Yeah, it's all organic.
So you didn't ask, I'll just throw this out here. When you're looking into hiring someone who do like Facebook ads or that kind of stuff for you, if they're probably not utilizing some of these videos that you've already had, or like pushing people to the blog posts that you're like your most popular blog posts, like that would be a really good way. It'll be more engagement. It'll be cheaper in the long run for you. But if people aren't even mentioning those types of things.
Yeah, no, that's good. I might have to even talk with you about this later because that's kind of one of the things that I'm like, okay. I've been lucky for so long. Money. I haven't. Yeah. Oh, totally.
they'll spend your money.
And I don't. I've learned a lot about being, an entrepreneur. And I say that in quotes because I never really thought of myself as one. But I do feel like I'm in a field and I'm kind of having to like forge my way through, things that nobody has really done, and especially in my field, like doing therapy fully online, even that's kind of, a point where people have criticized me. They say, well, you can't do that. It doesn't work. You can't see. And I think, well, if it didn't work, then my patients wouldn't be happy in getting results. And it's not for everyone, maybe some people really need that person to person physical, sitting next to you experience. But for a lot of people, they don't have a local therapist in their area. So I'm really just filling a void, like there's a big void in the field. There's not a lot of therapists out there. And, that will change. I mean, as my field grows, like I'm a trainer too. So I train other hygienists how to become myofunctional therapists. And I've got a course that I've taken. Over 100 hygienists have gone through my training program. And so, I try not to look at it as like I'm creating my own competition. I try to look at it as I'm creating my own marketing team, because I know.
Yeah, you don't have enough people to be competitive yet. It's like, as long as they're not in the same zip code as me, there's plenty of fish out there. Just go get them.
And you know what? There's so many dentists. There's so many chiropractors. There's so many orthodontists. And there's no shortage of patients, and there's no shortage of people who have these problems, unfortunately. So I try not to look at it as like that's a scarcity mindset, because it's tempting, it's tempting to be like, oh, what if I don't have enough patients? But, every person that I train, they're out there talking to dentists and orthodontists and pediatricians and ENTs about what I'm doing and what they're doing. And so I think it's like spreading it all out there, it's getting more people out there talking.
You're going to train that one person who is super into Facebook marketing and all this stuff, and like a really good advertiser and like a really strong business mind. And then it'll just take 5. You're like, I trained her. Why is she number one? Why? But that's what you need to really get the message out more. Like, you may find someone that way.
Well, and that's what I'm hoping. I mean, for 2019, one of my big goals is to get that message out there more and to actually, try. So far, I've just been, lucky that I've got a busy practice, and, I've got 2 other therapists who work for me, and it's going well. But, I think one of the biggest things about having a business or a practice is you've got to stay relevant. You can't just keep doing the same thing and, kind of resting on your laurels. You've always got to be what's new, what's different, what's changing. I think if you're not doing that, if you stay stagnant, then you're going to fall behind. So
one other thing too with Facebook ads, it's so strange. You're not really supposed to put like,
no,
you have headaches. You
Exactly.
suffer with sleep apnea. So it's like being creative, like,
I forgot about that. You're right.
does,
You're
does,
supposed to, you have to like word it like a
yeah,
certain way.
are pillows wet when you wake up? And it's like, how do you word it to like, what are the people bothering you? Like a
Hmm.
wet pillow, you have sleep apnea. And like, that's the hard part. Like when the advertising comes, that's like, okay, these are the issues they're having. Oh,
Yeah,
I got the solution.
that is tricky.
But
Yeah, I don't know. Have
trying
you
to
had to
figure
come
it
up
out.
with ways of doing that?
Well, the part of, like, I haven't had to really advertise for chiropractic yet, but like there's a bunch of chiropractors
Hmm.
that advertise for chiropractors. So there's, you just pay like somebody a couple $100 a month and then they do it all for
Yeah.
you and you don't have to really think. So they kind of figured
Uh,
it out. But when I was advertising
mhm.
for the podcast, sometimes, just promote an eye doctor, but I had to be careful. Sometimes it's like, oh, I'm like, oh, wait, no, I can't. Okay, that got denied. Let me try something else. Cause I'm just trying to advertise like what a doctor may have been talking about. Cause otherwise
And
we've
I
got an
can't really
optometrist on
tell
the show
why they
today.
don't like that, I guess, because I mean, if you are like a snake oil person, then, you could take advantage of people like, take this magic pill and lose 40 pounds. So I guess, maybe it's like to protect the consumer, but it
Yeah.
does kind of,
Negative
yeah.
self-image.
Oh, yeah, actually, you're right. That is some of it too. I have heard that as well. Oh
So
gosh.
crazy. All right, so we're gonna wrap this thing up here. Okay, so you have your own entrepreneurial business. You can do it from anywheres. You have a husband, and are y'all able to take vacation? Can you unplug and just get away from work? And if not, what's going
It's
on?
been really hard. I have I see 2019 as like, okay, this is the year I'm going to make it happen because right now, I mean, I feel like even though we travel, we do all this stuff, we can live anywhere and that's great as long as there's a good internet connection.
Yeah.
I've gotten to this state of like, I work all the time and it is hard to unplug when everywhere you go, your work can go with you. So learning to set up boundaries, especially because I see patients in many different time zones.
Mm.
I could literally work any hour of the day, any day of the week, because there's always someone somewhere who's like, oh, can I get scheduled? And so for me, being really strict with my scheduling, it's one of my goals I have to get better at because,
And you're on the West Coast, which is the worst time zone.
why is it the worst?
Because if I'm in Central or if I'm in like Florida, it's 10 o'clock at night. You're like, well, it's 5 o'clock here.
Yeah,
And then
exactly.
they're having to stay up, or you're having to be like early in the morning.
Yeah, so we've spent quite a bit of time living in Hawaii, and I like working there because I'm done by 5 o'clock because that's 8 o'clock, depending on the time, Pacific time, and that's like 11 o'clock Eastern time. So I can see all my patients. I can work, a good 8 or 9 hour day, and then I can still have dinner. I can go on a walk. But here it is hard because sometimes I finish work at 8 o'clock or 8:30 at night, and then
Start early too, then, huh?
I'm just like, I don't want to go. I don't want to make dinner. I just want to watch TV. I just want to like veg out. And I'm like so dead after the day that projects that I really want to work on. And, there's still like notes I've got to finish and there's emails I've got to send out and I'm just dead and tired. And so I feel like I'm a lot more productive in Hawaii because of the time zone. So it's interesting that you say that, being able.
Why'd you leave?
Why? Because my family's here in Seattle, so it's always pulling me back, So it's easy to go live like 6 to 8 months at a time, rent a place, a short-term lease, and that's kind of what we've done. So it works out, and we like it. And of course, like who doesn't want to live in Hawaii, So
I mean, it's super expensive there, though, I hear. Other
it's
than that,
super expensive, and that gets kind of wearing on you after a while. Just the food, the gas, I mean, the electricity, it adds up and you just feel like it's just like, it just gets old. You go to Costco, actually you kind of get immune to it after a while. You go to Costco and buy what you need and it's always pretty expensive. And then I get home back to Seattle and I'm like, oh my gosh, I didn't realize like that's so much cheaper than I thought, so.
What am I doing?
But when you're there as a local, it's a little bit different than when you're there on vacation. I mean, we find pretty affordable places to rent. Once you get out of like the vacation rental mode, where it's not like, $200 a night, once you find like a place to rent that's like $1,500 to $2,000 a month. I mean, that's like anywhere in the world. So it comes with its trade-offs. Like there's cockroaches and geckos and I don't mind the geckos, but we lived in a house at one point that was filled with geckos and it's kind of funny. Like I was always afraid I would be on calls and there'd be like geckos crawling on the walls behind me, and I'd have to be like, "Sorry, that's just our gecko house," So Or videos. We actually had some when I was filming videos there.
It's 3D wallpaper,
where
people.
the geckos would, be climbing on the wall in the back of the video. So, it is what it is. So
Yeah, we get geckos here every now and then, and they're just climbing around. I'm like, oh, there's another lizard in the house.
yeah, I guess you
like,
probably know from China. I think anywhere you live that's like warm and tropical, there's geckos and they like coming in the house. And the good thing is they actually keep the like ants down and they eat.
I prefer
insects.
that than a roach.
Totally. Yeah, I don't like cockroaches.
A roach is gross, but a lizard, I'm like, he's doing something.
I love the geckos, and these are, so if you look them up, they're so beautiful. They're called gold dust day geckos, and they're bright green, and they've got blue stripes on their body and like little red dots on their head, and they're really, really pretty.
They're so slimy looking.
They're not really
they
slimy.
Look wet
no,
all the
these
time.
ones like, they look like shimmery, I guess. I don't know the word, but if you look up gold dust day gecko, they're not native to Hawaii. They've been released there like, in the past 50 years, and they've just multiplied like crazy. So
no natural born killers.
Yeah, they are. So anyway, yeah, that's a little off topic, but oh well.
No, that's fun.
But yeah, I think the work-life balance has been a challenge for me, and it's one of my goals to get under control. I mean, I really, really have to, because I'm at this rate, I'm just going to burn out. I'm already like burnt out on a lot of things. So, not the work itself, but just the constant grind of just feeling like nothing's ever done, nothing's ever complete. I can never take a break. That's what I'm kind of getting burnt out on. So
automate. I mean, you said you had big plans for 2019. There's some things that could be done automatic, but I'm not sure how you would set that up with like a Zapier or, those types of things.
I will have to look into that. Yeah. I know some of your questions that we could talk about were about like hiring staff. I have 2 other therapists. I've got a full-time like office manager, like,
oh, wow.
Kind of behind the scenes person. And she's really, it's so helpful having that. And plus it puts kind of this divide between me as the therapist healthcare provider and her as, kind of we need your payment and, you're late for your appointment, so there's a fee and that, or you missed your appointment or whatever. So putting up that divide has been really helpful for me because, you can't really have that rapport and patient, like, I don't know the word, nurturing, and then also be like the money enforcer and the schedule enforcer. So, for me, that's been really helpful, but I had no idea it would be such a challenge having like a team, a staff. There's a lot of responsibilities that come with that I just thought, oh, my life will be so much easier when I have other people working for me. But now the jobs are just different jobs, so now it's like, oh, I have to make sure this is working okay, and she's doing all right with that. And so, the supervising role is something that I'm still learning. So yeah, if you have advice on that.
I don't, not really. No.
Like how to be a boss. I mean, that's been hard. So
you have 2 employees that are doing kind of what you do, and then a manager. Mm-hmm. Look at you. I didn't realize that. I thought, solo doing it all.
Solo person. I was for a long time, but in the past 2-3 years, it's ramped up quite a bit. The ironic thing is I hired these other therapists thinking like, oh, if I have a lower cost option for people, then, more people will be able to get therapy and there'll be more access to care, blah, blah, blah. It's kind of a reverse psychology situation. I have a lower cost option to work with one of my associates.
Yeah, you're the best.
And it almost makes more people want to work with me. It's a weird, psychology thing that I didn't foresee that. So it's made like now more people are like, no, we really want to work with you versus, I thought everyone would just want to save money and work with the therapist. So, that's been a challenge.
About 2 cash practice PT podcasts. And they're, in physical therapy, it's an odd thing apparently. Like chiropractic, we're like, everybody's pretty much solo. Like you work for somebody to gain a little experience and then you get your own thing. Like that's just what we do. There is no option. But for physical therapy, to be a cash service where they're not really in the hospital system or under the thumb of a doctor and they just do it all themselves, they're kind of like you. They're like, all right, I charge $125 or $175 an hour. My schedule's full. I want to become more of a boss. Yeah. And so they're always talking about how you hire somebody and then they charge the same fee. That was my point. They're charging the same fee. And then it's like, how do I position it? Because they're like, all my online reviews were, I'm the best. And now they're like, well, I want him. They're like, well, Bob's pretty good too. And they're like, well, Bob's not on the reviews.
I know. I'll have to get I'll definitely have to, I mean, I know a couple physical therapists, so I'll have to look at that podcast and then connect with them because I think it's very similar. Like when your business is you, how do you pull yourself away from it? I'm maxed out
Yeah.
pretty much with the amount of patients that I can actually see, and I'm still taking more on. I'm not like slowing it. I'm not saying, okay, I'm not putting like a cap on it. I'm just hoping that more people will start flowing to my associates. But I think the only way that's going to happen is if I raise my prices, which is something I didn't really want to do, because I also have this thing about like, I don't want to just be like charging
That's what they do.
astronomical rates. It's kind of exclusionary, I guess, And so, I mean, I guess I just have to do that because then it's going to make other people see my associates. But, the like ethical dilemma behind that,
That's what a lot
it's
of
a
them
battle.
do. The ones that I've heard, like on the interviews, his rates are one and a half
Yeah,
to
that's what
two
I'm going to
times
have
the
to
or.
do. Hmm.
Yeah,
Yeah, like $500 a session or something. I'm like, man, that seems ridiculous.
it'll weed out your schedule. You'll be like, I've got half a schedule
Totally.
now. But my associates and my therapists on the side are definitely busier now. So that's pretty cool. And you're
Yeah.
training people. I mean, that I didn't realize that either. Like you've trained like over 100 different people.
Yeah,
That's a big deal.
I train. Yeah, my other business or branch of business is called Myomentor. So that's myomentor.com. That I train dentists. It's mostly geared towards hygienists because I'm a hygienist, but I've probably had like 8 dentists go through it too. I've had a couple physical therapists. I tell them this is like a dental program, but if you really want to learn
Yeah.
it, you can go through it. So, yeah, what I'm trying to do is make programs that are more geared towards body workers and physical therapists, because I really feel like if you're a PT or an OT or a massage therapist or a chiropractor, integrating some of these tongue exercises could be really beneficial to your patients. So I'm trying to figure out how to get it away from just being like, you have to see me, the specialist, to can this be like a technique or a modality that other people can apply to what they already do. So that's a project I have that, I've got to clear my schedule so I can actually get time to work on it and put together these courses for body workers, I guess is kind of the umbrella term.
And I'm sure you've already noticed teaching is profitable. So
yeah, teaching is. Well, what it's done for me is I have a class of 10 students or 12 students, and I see them all 2 hours a week. So we have our discussion call the lecture call is on Monday and the discussion call is on Thursday. And so they all pay their tuition for the course, and then I see them so it's like more money all at once, and it's over a shorter period of time. So like my time goes so much further with teaching. And yeah, so I think.
Is this something that they can learn in one weekend?
No, so my course, it's like mentoring. So that's really what I've tried to do to set myself apart, because the typical training for myofunctional therapy is a 4-day weekend course. And nobody can go through that feeling like they've got it all down, So I've really just filled this void between training and real life. And so, the therapists who've taken these training courses, or the hygienists or dentists, they feel like I need more, like I need some guidance. I don't know how to start a business.
I saw this patient today. I don't know what to do.
Yeah, exactly. I want help, or I'm too afraid to network with doctors, or I don't know like how to talk about this stuff. So my program, it spans over, it's a 12-week program, and we have 2 2-week breaks. So it's about 16 weeks total. So it's a 4-month program. And I mean, my goal to anyone who goes through it is I want you to come out the other end, like actually able to practice. So seeing patients, networking with doctors, building a business if that's what you want to do, or integrating this into, like a dental practice.
Do you have to carry malpractice or anything like that? Or is it?
There is kind of a dental hygiene malpractice that we can get as hygienists, but, myofunctional therapy is kind of an odd thing. So there's some of these insurance companies are making like riders for myofunctional therapy as part of the insurance policy, but it's interesting being part of a new field where people are like, what do we do with this?
Yeah, because I mean, you don't want to get. I was just thinking about that. It's like we're talking about stuff that you could, if it can change something, all of a sudden somebody could have a bad experience, and then all of a sudden.
No, it's true. Luckily, I've never heard of that happening yet, but there's a first for everything. So
well, and that's the problem. Where you're gonna have some overambitious person who is gonna take it to that next level potentially, and be like, I can clean your teeth while we're doing it, and you're like, no, you can't. Yeah. You have to be supervised.
Or the patient, I'm going to do these exercises 500 times a day, and then they end up, their jaw falls off. Not really, but
They look Mr. Butch. They got these big cheeks.
Some crazy health problem that like normally you would never do the exercises that much. So,
Somebody died from you ever heard of biofreeze? Like a joint cream. Oh, my muscle hurts. You put some like painkiller on it. Like it's
Oh,
like
I know what it is. Yeah, but
menthol-based. Somebody died or something like that.
oh my gosh.
And you're like, what in the world? And this person was using a gallon a week or something
Yeah, it's
of
like
this
crazy
stuff.
stuff like that where,
You can't bathe in this.
yeah, you can't make it up. You're like, what? This is crazy. Like, I would have never even thought anybody would try that. So,
Yeah.
that's where I think for me having like I have like an informed consent that people have to sign. And, it talks about like the risks, even though there really aren't a lot. I mean, it's much riskier to get braces. It's much riskier to have like your septum straightened or your tonsils and adenoids taken out. So the thing that I really, yeah.
Surgery versus a breathing technique
Totally.
and a tongue technique.
Yeah, like put your tongue on the
Wow.
roof of your mouth. So, there's way, way more invasive things than even tongue tie procedures. I mean, having your tongue tie released is minor compared to some of these other things.
Yeah. So you're probably not a fan of like tongue rings. Is that still a thing?
I don't think it's good. My sister used to have her tongue pierced when we were in college, and I think back to
Yeah.
that. And her, I would clean her teeth as a hygienist, and the inside of her teeth were all chipped up from having that metal ball like
Hmm.
hitting the teeth. It makes me think your tongue probably can't stay in the top of your mouth if there's a piercing through it. So it's probably not good.
Yeah. I didn't even think about that. That's been a long time since I thought about tongue piercings.
I know, I haven't.
Wow.
Yeah, that's funny.
Good grief. Last two questions. I know you got things to do. Spouse, significant other. How do you keep the love alive in these days?
We work together a lot, and so I think because he actually he does a lot of my website stuff and a lot of my behind the scenes video editing and all that. So I think the biggest thing for us is like actually having space, because he doesn't go to work and I don't go to work. Like we both are at home all the time, so having our own separate like times I think is really important, where most normal people, they go to work, their husband or wife goes to work, and then they meet and they're like, oh yeah, how was your day? And we see each other all day. So
Like, I need to go to the gym.
so we're like,
I'll see
we
you.
need to separate for a little while. But then also being able to talk about non-work things, I think that's one of the things that can be a problem, where it's just like, okay, this needs to happen. We need to work on this project and blah, blah, blah. So realizing, taking time to like separate and not have like, let's not talk about work. Like, let's just go out to dinner. Let's just enjoy our evening together, that kind of stuff.
Yeah.
Being strict with that, I think is critical.
Especially if you both support each other and like he supports you, you support him in all your endeavors. It's easy to just fall back to, okay, all right, let's talk about the marketing plan for the next month.
Yeah, I mean, I'm super passionate about what I do, and so I'm always like, I know it drives him crazy. Like, I get ideas all the time, like, oh, and we should do this, and we should do that, and he's like, do you always like? Is there ever a day when you don't have ideas? And so. He loves it too. I mean, I shouldn't say like he hates it, but I think it probably
Sarah,
does
you should
get
learn how to
old.
do some of this stuff on your own.
Yeah, I know. Well,
I don't want to do all your editing.
yeah. Well, I mean, that's another, I think, entrepreneur thing to remember or to learn is like hire people, pay people. I wish that years ago I just would have hired an accountant to do my taxes. I tried to do my taxes for so many years on my own, and it was a disaster. And I'm like hoping
Definitely.
that those years just fall behind, because I'm like, I don't know if I did it right. I wish that I just hired someone. Now I'm like, I just would rather pay someone, and it's an investment. Even if it's expensive at the time, it's so worth it.
You almost have to if you're going to have all these different avenues of making money.
Yeah.
Other people underneath you. I definitely wouldn't trust myself to.
No, I haven't
do
done
any of
my own
that correctly.
taxes. I haven't done it in a while, but
Okay.
yeah, I think back like, when you're new and you're trying to like bootstrap everything and you're just like, oh, I could do my own website, like
Yeah.
that's not a good idea.
Now, bookkeeping is another story, y'all. You should be doing your own bookkeeping. I get that. Only takes, talking to the audience here. That doesn't take very much to like put your expenses in like a QuickBooks to get to the accountant.
Yeah, no, that is good.
Or
And
someone.
I've always done my own bookkeeping, and I've recently been looking into, they have these like $200 a month, like an online bookkeeping team. And I'm just like,
That's a lot.
it's a lot, but it's also like, what can they really do that's like so amazing that I can't do,
Yeah, they're going to tap into all my bank accounts.
Yeah, it is kind of weird. Or I think like, how will they know what these charges are and like how to categorize them? I think you kind of have to know like what my life is to know how some of these.
Yeah, if I have to do this much work, I might as well have just done it myself. If I have to like.
Yeah, like
know.
okay, there's like these 25 things that you don't know how to categorize them or what they are. Like, are they
Yeah.
business expenses or not? Then that would be a lot of extra work, I feel like.
Have you ever used like mint.com for your
I
personal
have,
stuff?
yeah, I have used Mint. There's also something that I tried. It's called Wave app, and
Mm.
it's an online accounting software, and they'll do like payroll. They'll do a lot of stuff. They do like credit card processing, and I always liked it, but I recently switched to QuickBooks, so now I'm just on
Okay.
QuickBooks, Intuit, whatever it's called now.
What do you take for payment? Are you Stripe online?
I do
PayPal?
PayPal. Yeah, so I send out
Really?
invoices through PayPal. PayPal's kind of cool. They actually send you like a 1099K at the end of the year with all the money that you've collected through them. So I mean,
Huh.
it's kind of like it's kind of cool. It keeps everything organized. But yeah, I mean, it's a 3% fee.
Right.
But I don't think that there's anything. I don't know that you can find any company that's doing payment processing that's less than 3%. So
Okay. Yeah,
have
I
you seen
forgot to
any?
ask you that because if you're doing a lot of online stuff, there's Stripe, there's like real terminals these days that you can do online and all these
Yeah.
different companies. I was like, I wonder what she's actually using to
Sometimes I
not
use
lose all her money
Square.
on fees.
I used to use Square a lot more in person when I could actually swipe a card, but now, I mean,
Hmm.
Square, if you just pin in, like enter in onto your phone, it's like 4.25%, or at
Oh
least it
no,
was. I mean, I haven't looked at it in a while,
that's a
but
lot.
it was a lot. I was like, okay, I can't do that. So sending people PayPal invoices, I mean, they do, it seems, it's really simple. Like if you have PayPal for business, I'm
Okay.
actually amazed how good it is. So.
Yeah, and they've never taken your money and held it hostage
Not
or
give it
anything.
back. No, actually, the more you use them, the more they like I could get same day, like I can get instant transfers now. Like the money that's
Oh, okay.
in PayPal now, they didn't always offer this to me. It used to be like, okay, we'll hold your money for 3 days and then you can, we'll
Yeah.
transfer it. But now it's always within same day, or they gave me the option recently, which I had never seen before, do instant transfers. So I think
Oh,
if you use PayPal a lot, if you do a lot of transactions with them, and probably if it's higher amounts, then
yeah. Okay.
they start giving you more benefits. So,
I think the people that get in trouble with it is they launch, like if you were to launch your program and
hmm
you were new and you had 200 doctors buy a $700 program and all
yeah,
through PayPal and they're like, that's a lot of money.
yeah,
And they can like just deny everything. And you're like, no, that was
that's
3 months of my
crazy.
life preparing for this grand opening. And this is what happens. And then you're like, oh no.
That would be really. Luckily, I haven't had bad experiences with PayPal, but I know other people have. I've actually had maybe two people tell me like, I refuse to use PayPal. I won't do business with that company, so I'm gonna have to pay you in a different way. And I'm like, okay. So I know
That's
people have
fine.
had bad experiences with it. Every
Yeah.
once in a while, I get someone who's like, "Can I mail you a check?" And I'm like, okay,
Can you
if
just wrap your cash in a black piece of paper, please?
yeah.
I'd rather not have to deal with your check.
I mean, luckily now they have like, apps that you can deposit a check. You can take a picture of it and it will deposit it without you having to go to the bank. But
That's true.
um, yeah,
It's still
so
risky sometimes. I hate to say it. A check's risky, but you get one or two bad checks, and all of a sudden you start looking at people differently.
yeah,
Uh,
exactly. I know. So
okay, before we go, any favorite
mhm.
books, podcasts, blogs that we should check out?
I think, and he might even be a good person to have on your show, actually. There's Buteyko breathing practitioner. His name's Patrick McEwen, and all of his books are really good. His latest book is called The Oxygen Advantage, and he does Buteyko breathing, but he's also put a spin on it, and he's doing like a lot of athletic
Mm.
training. So he talks about nasal breathing and the benefits of nasal breathing during exercise and for anxiety. And so what he does pairs really well with what I do, and he is like one of the nicest people I've ever met. So, and he's kind of a like famous guy in my world too. So, the first time I met him, I was like, oh my gosh, I got to meet Patrick McEwen. I've read all his books, and like I was saying, Dr. Zoggy's like a celebrity in our field. So
This is Buteyko breathing.
Buteyko, yeah. So it's Buteyko. And it started in Russia, and it's a really fascinating breathing technique. But I think of all the people who teach it, Patrick McEwen has really done, I mean, he makes it easy to understand. And, he talks about the science so eloquently, which is, kind of dry, complicated stuff. And he's Irish, so he's got his Irish accent that's really easy to listen to. And sometimes I'm like, what? What'd you say? But he's just a super nice guy, just a good human. So.
Perfect.
And then who else do I think if you want to look up someone like kind of like really interesting and semi-controversial, there's a guy named Naudi Aguilar who's the founder of Functional Patterns, and he is doing, I don't even know, I guess human biomechanics is what he calls it, but it's super fascinating, and it's really, he's doing things that I've never seen anyone else do with the human body and connecting dots that I haven't ever heard of connected before with like fascia and these chains of movement that we have that I'm not a
Right.
physical therapist or, I'm not in that world, but he is doing stuff with the muscles and human movement and stuff that I've never seen before. So Functional Patterns, he's an interesting one to look up. Those two people I follow, and I feel like I learned so much from them.
Very cool, very cool. It's always fun to meet the guru or the person that's like a star. You're like, oh my gosh.
Yeah, I like it too. So
cool. What's your website again?
My website is myfaceology.com. So myfaceology.com.
And the other one was Myomentor?
Yeah, Myomentor. So Myomentor. But if you Google Sarah Hornsby or Faceology, which is the name of my practice, a lot of stuff should come up. So
very good. Wow. This has been fantastic. I learned a ton. We went marketing. We went all over the place, business practices a little bit.
Yeah, good.
So I really appreciate you spending all this time and being so open and sharing with the audience today. And definitely hope that we'll reach out to you and you'll be able to for internal marketing for yourself.
Yeah, I hope so too. Yeah, no, that'd be awesome. And I appreciate you, asking all this stuff. I feel like a lot of times when I do these podcasts and I do interviews and stuff, nobody ever asks about the business side of things. And I feel like that's actually a big passion of mine. And I think someday down the road, when I'm not so busy and I can kind of transition a bit, something that's come out of all the stuff that I'm doing is I'm super passionate about people starting businesses, and especially like women in business. I just feel like I want to be able to do something somewhere down the road, of supporting women who want to start businesses and who want to like forge out on their own. And, I just feel like I didn't come from a family of business people. I've had to learn all this stuff on my own, like, the MBA of real life, so
that's true.
It's hard, so I like learning from people like you and, connecting with other healthcare business owners because it's a challenge, so, but we can all learn from each other. And I love that.
Absolutely. Well, that wraps up another episode. I want to remind everybody that we have some great affiliate links available. If you're into instrument-assisted soft tissue manipulation, we've got the Edge tool and we got the Hawk grips. Saves you about 10%. Also with the Edge, you've got the blood pressure cuff restriction system. You've got the G Suite inexpensive EMR in case you'd like doing cash practice. If you want to know what hosting I use for podcasting, it's Blueberry. Pure VPN, that's one of those ones I use to help keep my payments secure as well as access the internet more safely. You've got the Primal Paleo grass-fed protein, bone broth style. Save 10% on that. No sugar, allergy-free, gluten-free, dairy-free, all those types of things. Mentor box, get taught by the author. We got Set for Set for those floss bands that you may have heard about on one of the episodes. I really like those. Any Amazon products that you might want, click the link in the show notes pages. And of course, I got my own electric acupuncture pin to go with the No Needle Acupuncture book. From time to time, I'll have a bundle set where you can get them all together for a great price. I also have the free downloads at doctorsperspective.net/blueprints. And what lately I've been doing is substituting a fifth one. Like I've done a knee, and depending on the guest, I might do a different type. So check back there. So all those resources can be found at doctorsperspective.net/resources. There's also t-shirts at .net/t-shirts. Put up some new designs from time to time, like making lemons out of lemonade, shrimp po' boy, plus all the chiropractic and podcast swag that you could want. If you have any ideas for guests, please send me an email, justin@doctorsperspective.net. I'd love to hear who you think would be good or a profession that you may not have heard yet. If you can, send me a review. That's .net/subscribe, Apple, Google, Stitcher, Android devices. You just click that button. It'll take you exactly to the page you need to. You can write a review, hopefully a 5-star review. Like I said, it does help for other people to discover what we're doing here. And we've got over 100 episodes. This is going to be like our third year. Super excited. We're going to have a little mini-series like we've been doing, which has been fun. Hope you've enjoyed them as well. That's the feedback I've gotten. And one thing I haven't really talked about too much is the doctorsperspective.net/support page. If you want to host a cup of coffee, go for it. If you want to pledge a little higher fee, there's buttons for that. There's even monthly recurring for those who feel like, wow, this is like the cheapest mentor coach program I've ever seen because you interview so many different kinds of doctors and I've been able to implement things that I've heard and it works. So monthly recurring payments, which also can get you my books for free, t-shirts for free, the first book, that deals with health and exercise, getting on a diet, getting your financial health in order as well, things I've learned in China. That book is available as well. And one thing that I don't have like a full-blown page about coaching and things, but there's a little button there. I've had people request, hey, doctors and non-doctors asking me, can I do more than just answer a couple of questions? Or could you be my coach for a little while? And I say, yeah, we can do that. So it's something I haven't really advertised, but it's something that I can do, whether it's marketing, some strategies for new patients, growth, those types of topics. If you're interested, just email me, justin@adoctorsperspective.net. As always, listen, critically think, and implement. Have a great week. We just went #behind the curtain. I hope you will listen and integrate what some of these guests have said. By all means, please share across your social media, write a review, and if you go to the show notes page, you can find all the references for today's guest. You've been listening to Dr. Justin Trosclair, giving you a doctor's perspective.